very good afternoon to all of you. Thanks for joining us back again this time. Sorry, okay. Without much ado, let me introduce our speakers today. And he is Dato Dr. Abdul Halim, obtained his MBBS in 1975 and Diploma in Child Health, Royal College of Physicians and Surgeons in London in 1980. He served as a medical officer in the Ministry of Health from 1976 to 1978, during which he was seconded to Pediatrics departments of University Hospital Kuala Lumpur. And subsequently, he received his senior postgraduate training in Pediatrics at Wales National College of Medicine, University Hospital of Wales, Cardiff, in UK. He also received training in Wolfson Centres in London, child normals and abnormals, and as well as sponsorship under British Council in 1984. Dato Dr. Abdul Halim Abdul Jalil is a renowned pediatrician and having experience of 47 years. His areas of expertise inclusive of developmental problems in infancy and childhood, that inclusive of childhood autism, genetic and chromosomal abnormalities, that's including of Down syndrome, global developmental delay due to congenital, post-traumatic and infective causes, and also the quite common nowadays is called attentive deficit hyperactive disorder, ADHD, speech delay. That's just among the common things among the children nowadays, yeah. Especially growth problems in infancy and childhood, behavioral problems in childhood, and other chronic medical problems in childhood, including of allergies, poor feeding, including also childhood obesity. He started practicing as sessional pediatrician in KPJ Ambang Putri in 2009, and also at our hospital, KMI Taman Desa, since 2021. At present, he is the professor of pediatrics in Faculty of Medicine, Lincoln University College, PJ, and he also the very active research. He also advisor in the research team of the State University. So without much ado, Dato, the floor is yours.
Thank you very much. Sorry, I just made one correction. I have already, no longer serving in Lincoln. So I've already, my tenure for professorship after 9 years is already over. I'm busy with other things, looking after laboratory and cell laboratory and so on. Okay, so I can start now. Thank you very much for having me to present to the doctors. All right. I'd like to share that experience. So in the area of developmental pediatrics. The title of our topic today is the importance of special needs assessment and diagnosis at an early age. Can we share that? Okay. First of all, I like to emphasize, when you deal with a child in your practice, always remember that you have to look at it as a whole, and the child as a mother and the father and the caretakers and so on. The child is influenced by particularly the mother and the father, and also people around, and the environment too. A very nice, warm family relationship augurs well for the child's well-being, developmental and health well-being. Okay, so the other thing is every child's needs the same. They need love, they need security, and this will help to promote the well-being of any child. So, so the aim, right? I show you this one to show that the effect on the baby's health and development outcome is, it starts even in the utero, even before the mother is pregnant. You see, because now we are talking of epigenetics. We used to teach medical students genetics, but now we are talking on term called epigenetics, which has been, talked about more than 20 years ago. What is it? Epigenetics, epi means above. Genes is not your destiny. You're not destined by the genes, because genetic expression is what is going to influence the phenotype of the person, and also the developmental and health outcome of the person. Okay, so always remember, the point I want to say is, a mother who is pregnant, her thought content, the way, the positivity of the thinking influence the baby inside. The child, the mother's health, physical, mental, and social well-being will influence the baby, the fetus that's within in her womb. Okay, so remember that, if as much as you can, try to help the pregnant mother when she is, especially in a stressful situation, or she is not just physically unwell. Because she is unwell, you treat it, but you also consider if she is also under severe stress, she is not sleeping well, because all these things is going to impact on the child, the fetus environment inside. Okay, now the goals of healthcare should be to optimize the physical health and the psychosocial, intellectual function of the child. Now, what do we pediatricians look out when the baby is born? Of course, once the baby is out, we go through the APGAR score and make sure that there's no asphyxia situation, or it's got the structural defects that we need to take note of. And then before the child is delivered, sent home, again, we have another examination to see whether everything is stable and the child can go home. Of course, you will be seeing patients, babies who are born with jaundice, and they may have to be seen by primary health doctors. Now we have, checking the jaundice level with transcutaneous, what you call bilirubinometers. Right now, what we do is we examine a child in infancy, because the profiles of development of a child, namely gross motor, fine motor, language expression, and language comprehension. They must comprehend first before they talk, and the other one finally is social responses. So you know that you will be seeing babies, and you'll be giving vaccination, but pay attention to the acquisition of developmental milestones in the child. For example, you have a child 6 months, still not rolling over. You should be paying attention. What's going on? What is the tone level? The child at 6 months not rolling over, not even smiling. Yeah, the child is not reaching for objects, because a child rolls over at 3 months, reach out for objects 6 months, and then sitting, independently at 6 to 8 months, and then they stand at 1 year, and they walk as late as 13 months. My mom said I walk at 13 months, but you have to know developmental milestones: gross motor, fine motor, language comprehension, expression. Language comprehension, usually by 1.5 years of age, they should be able to know where's your eyes, where's your nose, where's your ears, parts of the face. And then when did they start talking? Some children, they start having baba, mama, single words, then it's a combination of words, 2 words, 3 words. Usually by 3 years of age, 75% or 80% of children should be able to speak in full sentence. Okay? That should be in your mind. Okay? So because you have to know your development milestones in order to pick up early developmental delays in a child in all these areas. Okay, so that we can check, is that a situation that needs what you call early developmental intervention, therapy, or otherwise. look at this one. You'll be handling treating children for infections, and then you might have chronic problems like persistent ear infection, respiratory allergies, asthma, eczema, skin allergies. Pay attention to a child with frequent upper respiratory infection, frequent runny nose, blocked nose, because they can get effusion in the ear. And if you get effusion in the ear, often it comes and go. But if it's prolonged, you have effusion in the ear, it affects the speech, it affects the hearing. And the child might be having poor hearing, and if it's going on too long, it's going to affect the speech development. Please take note of it. First 3 years, you want to make sure that the child's hearing is perfectly okay, because I'm going to allude to Down syndrome later on, but it's a concern to us. If the child has got prolonged effusion and is affecting the hearing, is going to affect the speech development. Feeding problems, what you will meet failure to track them. If they have failure to track, I think you will have this. Always keep a percentile, what you call develop. Always keep these charts in your practice and track them, because you will be able to monitor their growth. Weight, length, and also head circumference. Okay. Do not forget it's not just the dentist having to look at the child's teeth. The GPs should pay attention to dental caries and dental hygiene, because it affects the well-being of the child. Now we talk more of what is called microbiome. I'm going to talk much about it, but just know gut microbiome. In our intestine, we have good and friendly bacteria. There's a gut microbiome there, and you will have a situation where the gut microbiome is adverse situation that can come out with a variety of factors. One of it is excessive use of antibiotics. Please take note of that. And if there a medicine like steroids being used, or certain chemotherapies and so on. After treating, and then this is over, the treatment's over, you will have to think of to repair the microbiome of the child. Okay, now, all right. So just to reiterate here, please pay attention to the child's weight gain, length, and head circumference. Less than 2 years, you normally have to take the length on the bed, When they're after 2 years, then you can take it as standing position, all right? All right. But always remember that, can you see this one? Okay, this is just an extreme example of a child who's showing poor weight gain, when you find that the weight is crossing percentile downwards, then you have to spend some time. What is the nutrition like? Is it adequate? Or is there some systemic disease and so on? Track them and then correct it. Otherwise, you may get certain tests to see what is going on. Yeah. Okay. Now, I just put here nutritional needs. We don't teach much nutrition in medical schools. Curriculum does not have very much of that. But for me, I spend some time for my students. I tell them we don't have much questions in the examination, but it's important, it's critical that they do nutrition. It's important because most of the illness that we find in patients, a lot of it stems from what you eat. It's not just what you eat, the deficiency of nutrients and then macro nutrients, but also sometimes wrong things get into the system. We call xenobiotics. And now, you may spend a lot of money on food outside, but not realizing that sometimes in certain cases, this food stuff may not be healthy for a child. And now, I mean, if you buy from the shops now, you have to look at the ingredients, because too much of sugar is an inflammatory. Fructose syrup is inflammatory. Some children are going to get hurt by too much of sugar. But you also pay attention to also the kind of food they're taking. There's some children who just reject vegetables, and vegetables is where you get a lot of your what you call nutrients. I mean, we call polyphenols and polychemicals. Please pay attention to nutrition. Make sure the children are taking vegetables and fruits, different colors of vegetables, different colors of fruit, preferably local fruits. Preferably local fruits. And of course, now that you have a problem with even agricultural abuse sometimes. If it's produced, on soil that is not healthy, herbicides and what you call pesticides is going to affect the quality of the foodstuffs. And this is a concern worldwide now. Okay. Now, I just want to show you this. I did this study in 1980, actually, on international pilot study to see what kind of severe developmental disabilities we have in our country. There are about 10 countries, involved in the study. And we found we have the first stage, we'll give for 1,000 children questionnaires. And those with abnormal questionnaires, we have a detailed assessment of them. The result of it, we found 31 out of 1,000 cases of severe childhood disabilities. These are the categories. Mental handicap, 10, half of it, 15. Down syndrome, 1 in 1,000. Cerebral palsy, 1 in 1,000. Epilepsy, deafness, 1. Visual deficits, learning disability, speech disorder. I think autism, we didn't pick autism at that time. But I think probably looking back, they may be couched in this learning disability. Therefore, looking back, I am not sure whether we could put 1 or 2 cases of autism there, but because we did not specifically look at the diagnosis of autism there. But when you want to make a diagnosis of autism, the core factors, the core symptoms must be there. Core symptoms are delayed, what do you call language development, understanding of language, and also speech. The other one is poor social skills. They just cannot relate to people. They just cannot relate to the peers, okay? And they have some stereotypic behavior. They may be so over-focused on things. You can't imagine what the child is doing with a stopper, with a bottle cover, and they spend so long on that, they over-focus on things. Okay, so, right. Now, but just now we get, let's say, 30 out of 1,000. These are severe disabilities. That comes to about 0.3%. But if you include the mild developmental disabilities, problems, including squints, poor visual deficits, and mild hearing defects, learning problems, and behavior disorders, attention deficit, you'll go up to 10%. So our children in standard 1. So just pay attention to these conditions when you see any child in the clinic. But you might don't forget to look for squints. Certainly, by 6 months, you'll be able to know this child has got a squint. Remember, squint can be treated. You can find some children who are not treated the squints, bad squints, and they go on until 10 years, 12 years. The squint is not treated. Please bear in mind that we need to treat. We need to make sure the child gets binocular vision, because if one eye is squint, he's going to be getting poorer and poorer visual acuity. Okay, so we need to identify which eye is squinting, and then we have to treat. The orthoptist or optometrist will be treating. You need to cover the good eye and exercise the squinting eye. If it's not helping, you might get refraction to get special glasses. If not, sometimes you may even need to subject to eye surgery to make sure that you can get binocular vision. Okay, so pay attention to visual defects. Pay attention also to hearing defects. Most of the time, if you ask mothers, "Can your child hear?" they will say, "Yes, your child hearing." They're quite confident of it, and from my experience, I think they're usually quite right. But as a doctor, if you have a child with a delayed speech, 2 years still not talking, still no mama, baba, and the understanding is also poor, you will need to think, do I need to get the child referred to for hearing tests? Okay, even though the mother is saying the child is hearing, because hearing can be what you call mild hearing loss or severe hearing loss. A half-deaf child will still respond to banging of the door. So please remember that. Now, right. Well, these are some of the common behavioral emotional problems. We're going to touch a little bit on ADHD, what we call attention deficit hyperactivity disorder. We'll touch on autism in a short while. Okay, these are Down syndrome. Okay, now let me spend a bit of time on 5 minutes on Down syndrome. In the past, we used to think, oh, there's not much we can do for Down syndrome. 20 years ago, if the child is already 20 years old, from far, they would say, it's a Down syndrome. The way they talk, the way they walk, the way they look, the appearance is clear enough with Down syndrome. But now, actually, we treat Down syndrome with stem cells now. And as they grow up, if they follow the protocol, they are straight. And you have what we call correction of the discophalia, the head, yeah. And you also avoid the ever-increasing delay in development. You see, as a child gets older and older and older, if you don't treat the child with Down syndrome, the development continues to be slow. And then let's say at the age of 6 months, the child's development may be at 4 months. By the time it is 1 year, the child's development might be only 6 months. 2 years, the child's development in all profiles might be 1 year. And a child, 4 years, child development 2 years. So, we have found that if we treat them with the appropriate cell therapy protocol, you can actually avoid or eliminate this ever-increasing delay development. Yeah. But there are other things that you have to pay attention to. You need to know that Down syndrome, 30% of them may have a thyroid deficiency. They may have a cardiac abnormalities. Of course, these are correctable. Most of the time, the ventricles have defect, atrial septum defect. Sometimes you get a phalanstetrology. Thank God now our cardiac surgeons are good. They get quite good results. Majority of Down syndrome children with cardiac abnormalities. The other things also you have to pay attention. They may have hearing defect because they tend to have frequent viral infection and they tend to accumulate fluid in the ear. Please pay attention to that, because if a child Down syndrome comes to you and is having runny nose and cough, if they get blocked nose, they are prone to getting middle ear infusion. And the problem is it can go on for a long time and you end up with a delayed speech. Already the child is going to be compromised with delayed development, but with the hearing impaired, what you call this media there, which you can treat, and you have to pick it up, and then we can get our surgeons to handle it. Just to let you know, Down syndrome children, the external auditory meters is narrow, small, very difficult to access. Yeah, but now, if you have children with what you call fluid, it's critical that we treat it. If there's fluid in the ear, you must get it out. How? Because otherwise you get to affect hearing. So now, in the past, doctors will say very difficult to put a tube, grow back inside here because too small, too narrow. But now things are better now. You have a titanium growth mat, and you can get ENT surgeons. We can get it in as early as 1 year. It's so much better now. Also pay attention that the child Down syndrome, the treatment will be, if you have a triangle, at the top of it, you have a what we call stem cell treatment. Below everything, physiotherapy, speech therapy, occupational therapy, nutrition, because you need to make sure that they have got their, micro and macronutrient needs provided for. And you may need to give them probiotics, prebiotics, and so on. Yeah, okay. And the other thing I must tell you, that this is cerebral palsy. Always remember this. What we find that's worthwhile for you to know, vitamin D deficiency is quite common. It's so common now. Please pay attention to this situation. You may not check the blood level because it's costly, $200 to check the blood level, but it's okay. Take note of the epidemiology that's going that is available now. Even in Malaysia too, we find breastfeeding mothers, they are short of vitamin D, and they're breastfeeding and the babies get short of vitamin D. The last communication I had with my colleagues in Malaya is that they recognize that vitamin D deficiency is so prevalent that they're starting to what they call give even the newborns who in the hospital vitamin D deficiency. So please take note of it, that vitamin D deficiency is important for you to take note, and because it makes a difference to the child's well-being, it also in terms of the immune function. Okay, right. In summary, Down syndrome should be treated early, and right now, all I can tell you, our research is showing that we can treat it with a good outcome. All right, and this is not something new. It's already been proven even in 1980s, 1970s. Professor Smith of Professor Pediatrics in Germany, Heidelberg. Cerebral palsy. Yeah, pick up the earliest sign of cerebral palsy. You might find hypotonia in a newborn, and 2, 3, 4 months, changing tone. Might find that the child is because it might be a spastic type of cerebral palsy, it might be a hypotonic type of cerebral palsy, or it might be a dystonic type of cerebral palsy. These are the ones that, as they get older, they have the grimacing, what you call posture, and reaching up for things, and then they have a certain. I think. Let me see if the one in the center here. That is typical dystonic cerebral palsy. Yeah. Okay. So cerebral palsy is also another situation that we can treat. In the past, they are given just what you call treatment with physiotherapies and speech therapies. If they get fits, they have to treat them accordingly. But actually, stem cells also help children with cerebral palsy. Okay. Now, let's touch on very quickly autism spectrum disorder, because this is very common. I mentioned just now is in America the incidents have been said to be as frequent as 1 in 60. Remember, I showed the slide just now. I thought probably maybe 1 or 2 in 1,000 way back in 1980. But now I don't think the research that I've done is being replicated. Yeah, but it seems so common now. Some people are saying it might be even 1 in 100 in this country. We have not actually got a good epidemiological study, something that we have done as part of the International Pilot Project before. But you'll be, finding that there are a lot of parents who are concerned that a child is autistic. But very often, sometimes people, question, is this child autistic? And I get to see these patients, but often they are not. Yeah, but that's all right. At least the concern is there, and they get confirmation whether the child is really having core symptoms of autism. All right. Now, what's the cause of autism? Now, in the past, people thought it's a genetic, but it's not. answering all the questions. Is it environmental? Yes, to a certain extent, environmental factor. And then, of course, I brought up the epigenetic factors. There's so many epigenetic factors here. What you call high toxic metals, mercury and cadmium and aluminum, and all these things can affect the genes on an epigenetic level. That means it's not the genes, but what you call methylation of these genes. So this is in what you call with the term epigenetics, and resulting in expression of the genes into children with showing symptoms of autism. Okay, now basically you can say there's so many factors here leading to inflammation of the brain or neuro inflammation. Can be prenatal factors, can be perinatal factors, postnatal factors, and if you look at it, autism is the final common pathway, as a interaction of numerous disorders linked to a variety of genes. But it's not just the genes; it is actually the epigenetic effects on the genes interacting with the environment. That means the genes interact with the environment through epigenetic mechanism, and then leading to brain inflammation and leading to the symptoms called symptoms of autism. Many autistic children have got other problems, intestinal problems, deficiencies, biochemical imbalances, toxins, food allergies, and infections such as chlamydia and mycoplasma. Please remember, we used to hear people talking about gut leakage. Gut leakage. People used to question, is there such thing as gut leakage? Actually, when you take a certain foodstuff, some children cannot tolerate that particular foodstuff, and they get inflammation in the gut. And as a result of the inflammation, they open up the epithelium, the gut epithelium, and the what they call the cytokines, which are the inflammatory molecules, get through the epithelium, get into the bloodstream, and get into the whole body, get to cause inflammation in all parts of the body, including the brain. Okay? So, and one of the things that we, what I've noticed, that they help with what they call self-prescription, which will include stem cells of the intestine. So if you have not heard of it, it's something new to you, but actually we have demonstrated this and in many of our autistic patients. Okay, now, all right. This is in my book, actually. In my book on Hope for Untreatable Medical Disorders. And equal, I cannot remove this one. How do I remove this one? I want to read this one. Okay. Just let me read to you what I wrote in the book. The strong belief that autism is genetic in origin is not supported by current research studies. The researchers who have been looking at the genetic cause till today have just not been able to confirm this. It probably has been the wrong way to go about it all this while, and current research in cell biology has really negated the concept of genetic determinism. It appears that the genes are not the primary cause of autism. It is the way the genes are expressed, and this has to do with environmental factors operating beyond and above the gene level. That is through epigenetic mechanism. This is currently a hot area of research, so the pathogenesis of childhood autism now looks like brain inflammation, certain stresses, whether arising prenatally, perinatally, postnatally, or metabolic disturbances may be the starting point leading to autism. Therefore, autism is the final common pathway or expression resulting from the interaction of genes in combination with various environmental factors that acts as a triggers to cause epigenetic expression for childhood autism. So this was, a summary of what I've been talking just now about causes of autism. Can we go back to attention span deficit? Okay, I give an example of a child with attention deficit disorder coming to the clinic. Comes to the door with the mother, and the child will be going straight to maybe the fridge, open the fridge, and take something out there, and come and go on to the what do you call the bed, jump up the bed, and comes down and then comes to towards me and take my pen and like Billy the Whiz, that's the typical hyperactive child. Okay, but you must also understand that just because the child's behaving like that in your clinic, you have to also ask: is this the same situation in other environment, at home or supermarket and so on? Because just to make sure whether the child is reacting this way only in situational hyperactivity. Okay, so to diagnose ADHD, first, of course, the hyperactive behavior and also the poor attention span. Eye-to-eye contact is very very difficult to get eye-to-eye contact. You try to have an interaction with the child. Normally, let's say a 3-year-old child coming, sit down, and of course you looking at you. That eye-to-eye contact is important to elicit that. Yeah, and children with poor eye-to-eye contact, either they have ADHD or some of that they may be part of the morbid factor in an autistic child. The autistic child may have also comorbidity, ADHD. Because autism, they can have comorbidity with epilepsy and so on. Yeah. All right. So always pay attention to any child who is said to be having symptoms of autism or ADHD. Make sure the hearing is always checked. All right. Okay. Now. All right. Okay. Now I just want to show you this one. Special educational needs, actually. Sensory deficits, learning problems, disabilities. What are learning problems? There's a term we call dyslexia. This is specific learning disorder or disability. It may be in the form of the child having a problem with reading, writing, and counting. Reading, then you call it dyslexia. They have difficulty in writing, dysgraphia, find it difficult to understand mathematical concepts, dyscalculia. But please remember this also. There's some children, people make the diagnosis of dyslexia at 3-4 years old. Always consider that could this be just what you call a developmental delay, because some children, they are not able to pick up, reading, writing, counting until later on. There are some children like that, they pick up these disabilities later on, and they get over it. There are some children I've met, they are actually, they turn out to be quite very, very smart, actually. And standard one, teacher says, it's slow. So why? You can't read. But, the child is almost like, I've met one, like a math suicide. But the problem is he looks at things different compared to what other children are looking at. How to solve the problem, they solve it differently. But and we asked them, how is it that you were having problem reading at standard 1 and 2, and now you're reading and you're writing and you're showing exceptionality? And one of the patients said, I don't read the way you read. And he's got a certain way. I digitalize everything. I'm not sure how they do it. But always please remember that there are some bright children, who were made the diagnosis made dyslexia, but it turned out to be, not the case. And then, in history, even people like Einstein was said to have problems in the early stage of the education. But you know what they are. Okay. Now, I think just a quick look at attention span deficits, learning disabilities, speech delays, development delays, autism, and so on. And we want you to, verify this as soon as possible, flag this, get this diagnosis after, looking at the developmental profile, and so that you can appropriately refer them so we can plan treatment for the future. If they are less than 3 years, we have a early intervention program where you can improve or accelerate their what you call speech, language development, and motor development also. Okay, and many of these children will require multidisciplinary approach. They require speech therapists, physiotherapy, and what we call occupational therapy. But you also need a doctor, pediatrician or child neurologist to be able to what we call get the assessment done, because you have to have the child being looked at it comprehensively. Yeah, because you need to know, is it just a motor problem? Is it has it got an intellectual problem, mentally handicapped at some time, or he's got a mental problem, he's got epilepsy that needs to be treated, or he's got some what you call nutrient deficiency or some other genetic problems and so on that we need to pay attention and treat. Okay, now can you remove this one? Yeah. So I just put this as whole message. It's our hope that all children will receive the nutrition, physical activity, experiences, and care needed to be in school with healthy minds and bodies, and to have the mental alertness necessary for learning. Those with developmental dysfunctions should have access to early intervention program and developmentally appropriate preschool education program to help them prepare for formal school and, if necessary, remedial education. All too often, we meet children with developmental dysfunctions at 5 years of age and above who have yet to receive the required developmental diagnosis and treatment program. Consequently, the developmental dysfunctions are more severe than they should be and makes it more challenging to obtain the best results from the therapy and rehabilitation program put in place. I'll give you a situation. If I have a young child, let's say 1 to 2 years old, and the mother is concerned, could this child be autistic? Yeah, we have a way to examine them, to do a neurodevelopment assessment on these children, of which you can also come out with a developmental milestones. Because when you do a neurodevelopmental examination on a child, we also get the developmental milestones of the child. Because the milestones actually it's all couched within your neurodevelopmental examination. But if you have a child with core symptoms or some symptoms of autism at 2, 3, 4 years old, you can, may be able to correct this either nutritionally or either with early education, preschool education, either because he's got a hearing problem or because he's got some biotic elements, so you may have to detoxify and so on. But if the child comes to me, let's say at the age of 5, 6 years, he's going to normal school, a formal school 1 year. We don't have much time, and very often we may need to treat. We treat themselves actually because you get results quickly. But just remember, the idea is catch them as early as possible. Then we can do a lot further. I'll give you an example. I have one child who was 5 years, many years ago, 5 years old, autistic boy, yeah, and younger sister, at the age of 1 month, who was not the mother was a doctor, was concerned the child is going to be turning out as autistic like the brother. And when I saw the child, a beautiful girl, he's not looking at me, he's looking sideways. There's no eye-to-eye contact. So we have to train the child within 2 weeks, because it was when I was in family LPP, and at that time we have a child care center. So we trained the people, the facilitators to get eye-to-eye contact, and within 2 weeks it's corrected. And later on, nice story that both the brother and the child, that's 20, 30 years ago now, they're both professionals. So you can correct, you can train many of these children who are autistic, and then because in the book sometimes it gives you a very depressing outlook that nothing can be done. No, actually you can do a lot for these children, but you must get them early and then start the appropriate intervention program, right? Okay, so I think all right, just to show you try to recognize and flag this kind of condition. Development problems in childhood and infancy, child autism, genetic and chromosomal abnormalities. Down syndrome is treatable. Many of the what we call genetic disorders, even Duchenne muscular dystrophy, theoretically you can treat them, but you can't treat them conventionally. You need to have stem cell treatment for many of these cases. Okay, and then I think growth problem is something you need to pick up early and then correct them. Behavioral problems, you may need to refer if you have the concerns that cannot be, corrected. Other chronic medical problems, obesity is one. Because the other thing, just to tell you, some children who are obese, the question is the obesity resulting in vitamin D deficiency, or is the vitamin D deficiency leading to obesity? This might be controversial, but certainly don't forget that vitamin D deficiency is almost a pandemic situation. Pay attention to that, because you might be able to improve the obesity in the child if the child has got vitamin D deficiency. Okay, I think just this is the area that I'm involved actually. These are to tell you, these are the history of it. The first book was done by the father of cellular therapy, Nehan, in 1960, and after you have Frank Smith, professor of pediatrics in in Germany. This book was written in the 80s, and then my friend and mentor was ahead of me. His book in 2006, and that's my humble contribution 2011, and that's my contribution 2017. And I think I will stop there, and I will welcome if there's any questions or comments from you. Thank you.
Sure. Thank you, Dato. Informative lecture. We have a number of questions from the floor actually. So the first question: how does pregnancy factors influence the developmental outcome of a child?
I mentioned just now, please, when I look at a pregnant woman, she has got what we call the genes. But remember, we're talking about epigenetics. Whatever she has got, the epigenetics or epigenomes in her has also come from her mother and a father and a grandfather. They have gone transgenerationally. So what we want to emphasize today is the mother in the situation. She is going to influence the fetus inside her with the thought content that she's having, with the physical and mental problems. If she's got if she's got a physical problem, she may have a diabetes, physical, medical problems. That can also impact on the child's health, the growth of the child in fetus. And if the mother herself is highly stressed and she does not sleep well, I should have mentioned just now, sleeping is very important. Please, we all have to remember, we have to have good sleep, because if you don't have good sleep and it's going on all the time protracted, you're going to age your cells, if you are 60 years old, your stem cells are 60 years old, and you're going to age, you get stale aging. So remember, pay attention to mitigation of stress, pay attention to, sleeping, good rest, good relationships around. If you have a very morbid relationship at home, spousal relationship is bad, and then angry at people around you, and you're so stressed, it's not going to be healthy, because you have all the negative neurotransmitters in your brain, and that's going to influence your cells. Remember, thoughts will influence your cells, okay? Influence yourself. Healthy thoughts will influence the cell function, okay? And morbid thoughts influence your cell function negatively, okay? And therefore, it can also affect the fetus. But of course, not all fetus will be affected. There's some fetus are made differently, some even twins also. One twin slightly different the other one, because there are epigenetic factors that will operate in all of us. Okay, so we may have seven. We are seven in the family: father diabetic, mother diabetic. Not all of us get diabetes because there's other factors that are operating. We call it epigenetic factors. But in the past, we used to say, "Oh, the genes," but it's not the genes. Our genes may be the same, but it's how the genes are being expressed. Okay, right. So I hope that helps.
At a lot of in Malaysia or in globally, there are a lot of infertile patients who actually sought treatment of probably doing IVF, ICSI, also in vitro treatment to get pregnant. So by nature itself, they are stressful. They're already very stressful, are not being able to conceive, and having to go through the process of IVF, injections, hormonal, and the expectations and all. So in your current practice, clinical practice, do you actually see that actually links to the outcome of a child?
I get your point. I see these IVF babies, and talking to them, they get very excited. The parents get very anxious. We may be talking, and they get the feeling that they are very fussy, and they're worried. They're worried because IVF pregnancy, they've been through so much here. But that is the role of the doctor, to comfort them, to tell them that it's important for them to be relaxed. It's important for them to have a long-term view of things. There are two things. First thing, you must be patient. Yeah, patience, and you must, be thankful. Between patience and thankfulness. I mean, quite often it's easy to say, but when they have gone through this IVF program and so on, they've already had that makeup, But you can always change. You can always change. Yeah. How do you change it? I mean, the people around you must be able to help to promote change. I think. If you have a very, very anxious husband, is not going to help you, But you have your spouse. It matters. And you have a friend, a grandmother who is very calm and so on. Grandfather is very calm. It helps you. But if all around you are all equally nervous and so on, it's not going to help you. Yeah? So remember, your own thought content can affect the people around you. And if you are a very anxious grandmother, mother, you affect your children. Don't. Everything is don't. The child cannot develop confidence. All right. So please pay attention to that. Your mental tone is important. In molecular terms, we need to have a lot of serotonin, and you need a lot of dopamine. Okay. So that this is what happens when you're calm. When you're calm, you do things better. When you're anxious, you don't sleep, and it affects your health, and it affects other things also. Right?
Understand. Okay, now we move on to the next question. What are the available treatment for children with autism available now?
All right. I can say in the past, 30 years ago, the only thing we offer them was the diagnosis. Even then, the diagnosis was made late, before 30 years ago, And then the treatment will be speech therapy, special education, right? But now, since for the last 14 years, it started actually with my colleague, the one who was the writer of the text book preceded me, because we were in the team actually. He was in Hong Kong, and he started treating one 9-year-old child with autism, and the result was remarkable. The child is a bright child, but he's got what we call problem with a social interaction. Yeah, problem of understanding what people think of him. A problem about forming social relationship. Okay, and but after the treatment, the child said, he's a different child, he starts improving in terms of the interest, because the attention span has improved, okay, and the ability to train is better. Because when your attention is better, of course, the teachers will find it easier to train you, right? So, and since then, we took, the lifestyle therapy approach, protocol to treat autism, and we find it works. And even now, we treated so many already. But the idea is get them early so that they don't need stem cells. Get them early so that we can correct them, either through avoidance of certain xenobiotic factors, either correcting of the gut microbiome, correcting, they maybe have certain infection, not the infection that causes diseases, but the signature of the infection there, which result in what we call neuroinflammation, right? So, and then we get certain nutrients. I have a certain nutrient protocol actually that we need to give these children, and then we follow them up. But if they come late, let's say 5 years, they've got one more year in school, and then we have a what do you call stem cell treatment together with the rest. But stem cell treatment must always be looked at. Don't expect just stem cell to work, because you give the stem cells, but you don't correct the allergic factors, didn't correct the nutrition deficiencies and xenobiotic factors. You are not going to achieve get good outcome. You want to plant durians, you want to plant good crops, you must make sure the soil is good. All right, so correct it. So what you need to do, pay attention to the diet, pay attention to all these other factors, and then you get optimal results with the stem cell technology. Okay. So, and the other thing, a lot of understanding, the parents must be trained or taught in terms of parental effectiveness, because they need to know what to do when the child is, acting up. You see, because an autistic child, when he gets into an environment, he gets crazy because it's so foreign, it's so tension provoking. You have to understand how to handle children like this. Yeah. So I think autism and developmental problems, to me, is such a very rewarding situation, because you can do something for them in all this that I've discussed.
How early to diagnose autism?
I mentioned just now, the child 1 month old, I mentioned just now, the gaze avoidance, the brother 5 years old, autistic, all right? But the child, the girl, beautiful girl, in a cot, looking sideways, here am I, he's not looking at me, just not looking at me. So you turn,
1 month old.
1 month old, okay? So we train the childcare workers, do this, okay? Sounds, touch, okay, a lot of pleasant, because you need all this warmth, a sincere, warm feeling, love for the child, and the child respond 1 2 weeks. But if he's not working, you have to get back to the because I think you need a little bit of experience and confidence to do that. Having said that, while I say the importance of the attitude, the feeling that you have yourself, that you can train. Why? Because I've seen my autistic patients getting married, okay, and one father, doctor, at a wedding of the child, your success story. You get a good outcome, but you also get not good outcome, because when the parents are not the canons are at opposite side. One is here, one is here. It's not helping the child. But when both are committed and we both work with the doctor concerned and the therapist concerned, you can get good results. But they need a lot of support. They need a lot of help, guidance, and assurance that whatever you do, it impacts on the long-term outcome of the child. Remember, I give you an example. I had one autistic child in 3, 4, 5 years. But whenever they come to my house, I happen to have a son also, so a doctor. Whenever he comes to the house, typical behavior of autistic child doesn't understand how to interact with you. But we take him in our wings, holding and playing together. But the label of autism after many years, he's gone. Yeah. What does this show? You need to get to understand the child. And you need to know that some children can be very stressed situation. You have to get what you jive with the child, play with the child. The way they play may be pretty odd initially, but that's how you start getting. And then later on, they may still behave in a way that something is not quite right, but they have made strides in the social skills, right? Okay. We can train animals. This is human being. You can train them.
Okay, following question, Dato. How common is autism in the country, and what is the long-term outcome of with a child?
I think it's getting more and more common now. I talk to people socially. Say, oh, I've got an autistic child. I've got an autistic child. The neighbor is autistic, but I don't have epidemiological research that is done the way that we did in 1980. Because what we did was we had 1,000 children selected, and then questionnaires, and then 10 questions, and those with abnormal questionnaires we picked out and review that, even with the psychological testing, and we can get the data, and then we compare it to other countries. But that was in 1980. I think many of us were not born yet. But I think if you were to do that one, because that was done actually in a place called Sentul. Okay. But my feeling is, I think it's common now. I think it's more common now. I won't be surprised. It might be even 1 in 100, but I cannot be exactly sure about it. But there are many people who, because they hear so much about autism, my child might be autistic. They come to see you just to see whether it's autism. And then many of them, thank goodness, no, these are autism. Yeah, so at least they get reassured. And once they feel, oh, it's not. And then you train them, you make sure the nutrition is good, right? Make sure the hearing is normal, and then you're on special therapy, and then get better and better and better. And the label of autism is not there. Okay. So just remember that we have autistic patients who have got married. There are some people who are autistic spectrum disorders. They are actually bright, they are smart. It's smart, and they end up really good. But of course, you can't put them at the customer counter to deal with public, but they will operate very well in other situations.
I see. Okay. All right. So the following question. How do you make a diagnosis of a child of having the learning difficulty?
It's talking dyslexia. Oh, I mentioned dyslexia just now. All right. Now, I get quite a number of patients coming to me with the question, what's the problem? I wonder whether my child is dyslexic. The child is 3 years. Okay. So why? Because either the Tadika teacher might be concerned, but you must understand, just because the child cannot write, say at 5 years old, we need ask them to write P, they write Q, right? And they say, oh, the child autistic. No, don't jump to conclusion. Because when you developmental assessment of a child, you have to do it in a certain proper order, and not just your child is autistic. Why? Because he's copying everything opposite. But because sometimes it's a developmental hurdle. It's the time the child needs. The age is not ready to be able to handle that. I remember some children just cannot do maths, and they're very poorly performing very poorly. Even my classmate, we used to think, how is he to handle maths? Other subjects okay, but to our surprise, later on, he turned out to be a statistician. Okay. All right. So remember that that everything is changing all the time, but you can engineer the change to be on the positive side, right? Don't just look at it, everything is negative now. Yeah. You must have the understanding and the technique to be able to influence the positive outcome. Sometimes some children, how come things have changed? 1 year ago, it's not like that, because he's hero worship the auntie, and the auntie becomes the icon, and the auntie teaches him. And then he follows. Just like you, if you are your icon is one of the actors, you want to be like John Wayne, you pattern a lot of it. So I mean, this is one of the way. For somebody to influence a child's outcome. Right?
But what are the features that we're looking at for a child that have dyslexia?
Oh, dyslexia. Okay. There may be. I mean, a child with appearance. There's no issue, right? Nice, beautiful, handsome-looking boy. Somebody says he's dyslexic, and they come to you, and then we run the developmental assessment, and we found that maybe 5 years old. Okay, then the one who's really dyslexic, they have a problem with, with writing. They need special program. Okay, I'm not saying that there are cases they are really dyslexic, so they need another approach. All right. Okay. Instead of you want to teach a child numbers, you write on the board, they cannot figure that out. But when you take them to a kampung where they are rambutan tree and so on, bawa tiga, and then they learn better that way. Then in the class learning 3 and 5 and 6, 7, bagi kakak 3, bagi abang tu 5. Bukan itu 3, 5. They learn that way, and it's a functional. They learn functioning. They're much better, and teaching them that way may be easier than treating them in the blackboard. And later on, when they understand the concept of numbers, they can get it generalized too, right?
Okay. So that means that sometimes the conventional way of teaching may not be suitable for a certain child.
Yeah, we are not made the same way. Look, if somebody may have a Lee Chong Wei might not be a mathematician, but he is exceptional in another way. Children are like that too. You ask, what is the strength of this child? Always think, he's got certain, God is fair. He gives something and he doesn't give something, right? Always I think if he doesn't have this, I give you an example. One child was a 14-year-old child, autistic child, all right, autistic child. I saw the child at the age of 12 years old. I wish I had seen it earlier. But what has been said? The child, that guy was in the plane, went for a holiday trip. Came down. You know what they're saying? There are 5 children there. That boy is the one who was going down to look for a wheelchair because he felt that the grandfather is not well. Some of these children, they have got certain sixth sense that the other children are not having it. So always, be what you call cautious, and just not think that everything is down with the child who is having core symptoms of, because they may have some other exceptional abilities there, right?
Yeah. All right. Okay, Dato, there's no more other question already. So do you want to wrap up? Do you want to give advice, or you can say a words to our general practitioner?
I just want to reiterate certain things for the audience, GPs. Aim at picking up developmental problems early. So you need to know what you call development profiles. Pick up growth problems early. And also remember, I reiterate again, vitamin D deficiency is common. And especially during the lockdown, people are at home. And you can imagine that old people, they are always indoors. And they get COVID and they go to the hospital. Quite often, their vitamin D is low. And you want them to have at least 40 to 50 nanomoles per liter. And the one, when I test them, what's happening? They are 20s. And I have one of my, even my colleague, was a surgeon, what's happening? I got vitamin D deficiency, how do you know? I was, he's operating all the time, operating indoors. After something I felt giddy, I felt not well, someone. I checked, I got vitamin D deficiency. You can treat vitamin D deficiency now. In the past, we used to give them 400 and 800 international. No, we use up to 6,000 or 10,000 international units now. Okay, and then now you have a good product. You can have even 25,000 international units. Just do that once a month. Okay, once a month treatment. Okay, so I mean there are a lot of things you can do, but I just reiterate that my colleagues in University of Malaya, what do you call when I brought out a pandemic of vitamin D. They said, yes, it's not. You know what we have done? We have supplemented our newborns with vitamin D. So, you know, it's already there, recognized. Okay. So please, GPs, please recognize this. If you cannot test it, you can give it. All right. They're good products now. Okay.
Okay.
Vitamin D.
All right.
And
Thanks,
don't forget
Dato.
also other vitamins as well. But try to make food your medicine, medicine your food. Okay. Don't just depend everything on
Nutrition,
science.
good nutrition. All right. Thanks, Dato. Thanks for the
You're welcome.
wonderful and informative talk today. I'm sure all of us is benefiting. Listening, this is a fantastic talk. So thanks. Stay tuned for our next talk. Will be next month or end of this month. Not sure yet. But thank you very much. Thank you, Dato.
You're welcome. Thank you very much.
Thank you.